Okay, as it goes. Oh, I'm just doing that. Don't want to see that yet.
And I see that the chat function is enabled now. Just got a message on the chat saying, so with the webinar function is for the mics to be turned off. And there is a Q&A function as well. So if you have any questions, then please pop it on there. Hope that answers your question.
Someone's asked, thanks for the session. Will we be going through questions or just tips? Bit of both. Bits of both. Cool. So it's 7 o'clock, isn't it? So depends what you want to do. Do you want to start now or just like wait a couple more minutes? People can
we'll wait a couple more minutes. I think people are still trickling through.
Good.
There's just one chat. Can you please let me know if you can hear me? I can't hear you, so I think it's turned off. The mute function isn't visible. Yeah, so it is on a webinar at the moment, so I don't think you'd be able to talk unless you want to. Then I can enable that function if you do have a question. This will be recorded after, this is recorded during as well, and it'll be uploaded on our YouTube page. So it'll be there for you to view.
Good. Awesome. How's everyone's day been? Is everyone looking forward to getting some revision in over the bank holiday weekend? Give us a Y or an N in the chat function. Yeah.
Nope.
There we go.
Some Ys.
Yeah. I mean, this kind of like this holiday period is going to be great to get like a decent amount of revision in. You rarely get, unless you're taking time off, you rarely get like 4 days in a row. There's another one in like May where you get another 4 days, I think, the May Day bank holiday, which is like the last 4 days before the exams kind of break. So make sure you make the most of it. Shafan's given 2 Ys. Why? Yes. So they're going to revise twice as much. Good. Cool.
Okay, I think we can make a start. So just some quick intros. My name is Tanya. I am the BPSA Vice President, and we're really lucky to have Sarah here from RevisePharma. We'll be doing a webinar on pharmaceutical calculations and exam tips. And I'll let you introduce yourself.
Yeah, so my name is Gia, founder of RevisePharma. Started up about 2 years ago. I'll quickly go into that in a bit. Just wanted to give a bit of story about how RevisePharma started up. But today's session, we're looking at pharmaceutical style calculations and then exam tips, some things to consider for the exam, and then we'll follow that up with a Q&A. So let me get started. I'm going to go off camera for this part as I talk through. I can't walk and chew gum at the same time. But yeah, I'll turn my camera back on at the end. For now, let's get on with the slides. So welcome to the session. Just a quick bit about RevisePharma. What is RevisePharma? So a little bit about myself. As I said, I founded RevisePharma about 2 years ago. Sat the exam in March 2021, so I am pretty aware of what the exam is like, having it being done quite recently. I got 95% overall, 100% in calculations, and yeah, I mean, I like to tell people that because I don't know, it's something that I was quite happy with achieving. I never really did too well at university with exams, so it was nice to finish this last exam with a bang. My career, what's it like? So I started off as a trainee pharmacist in community, and then I worked as a locum for a bit straight after. Now I work as a research analyst for a pharma intelligence company. and I work on healthcare projects and give insights into regulatory affairs. So it's a bit different. I like to think anyway. But yeah, that's what I do. This is our page, RevisePharma. If you haven't liked it, go give it a like or follow even. There's loads and loads of free educational content on there. There's no harm following it. Just go for it. It's at RevisePharma. You can quickly even do that now, if you really, really wanted to. Cool. Just want to get a bit of kind of engagement going from the crowd. Use a chat function. What sector are you based in? So are you community, hospital, GP? Anyone still at university? Feel free to put that down as well. Cool, still got some unis. Awesome, 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 awesome. Cool, so the calculations will be a bit more guided towards like GPhC style calculations, but nevertheless, there's no harm learning it now. Good, good, good. Right, who follows RevisePharma and who doesn't yet follow? This is just like, just trying to basically fish for attention right now. Just followed it right now. Perfect. Go follow it. Loads and loads of free educational content on there. And yeah, it's a great little community. Be honest. You don't have to answer, but if you answer, just be honest. Are you a last minute reviser or are you a slow and steady reviser? Bit of both. Last minute. Yeah, again, a bit of mix. Last minute, but I'm trying. Yeah, I know the feeling. Yeah, so I won't lie, at university probably didn't set the best example. I was probably a last minute reviser, but the GPhC exam just isn't something you can do last minute. So for those in university, try and get out of that kind of mindset. That's just my little preach for today. And then next question, who prefers clinical and who prefers calcs? Neither. At least you're honest. Cool. So yeah, it's pretty 50-50. I personally really liked calcs. But surprisingly, after the exam, I thought I failed calcs and would have passed clinical. But calcs, yeah, I know what you mean. It's not the most easiest thing in the world. And that is something that people do take a little bit more time just practicing. It's not like clinical. Clinical, you just memorize, right? And calcs is just a bit more applying yourself to the question, which practice makes perfect. That's my opinion anyway. Cool. Who knows what day this is? Is it my birthday or no, it's not my birthday. Cool. Judgment Day. Wow, intense. It's exam day. So how I like to put it is your first day of freedom, because I'm sure everyone's going to do amazingly, and that's the vibes that we want to carry through. How long have we got left? Not doing this to scare anyone, just a bit of background information on how long we've got left. 2 months and 22 days. 11 weeks, 6 days, 83 days. How are we revising? If we're revising weekends only, that's 38 days left. If we're doing 10 hours a week, that's 195 hours left. So, I think anyway, is it 10 hours per week? No, my math is terribly wrong there. It's 116 hours left. But yeah, we'll let that bit of calculation slide. That's not part of the calculation session yet today. On that note, let's get stuck into calculations. So how does everyone feel about getting stuck into calcs? Are they ready? Are they excited? Are they exhilarated? Are they in awe? Yeah, I think so. Okay, so what we're going to do is I am going to set 3 minutes per question. And then when I say answers, I want everyone just to spam the answers that you've got into the chat. Don't be scared. If you got it wrong, you got it wrong 3 months before the exam, not during the exam. That's the way that I'm going to look at it. Let me get my trusted timer, or also called clock on apps. Right, 3 minutes for this question, and then we'll quickly go over it, basically. So 3 minutes for this one. Your time starts now. Okie dokie. Let's hear the answers into the chat function. Come on, let's see. Loads and loads and loads of fours. Exactly what we want to see. Cool. Amazing. So I'm going to quickly go over it. We had one person say 3, one person say 12. Let's quickly go over the answer. So after each one of these questions, I'm going to basically give you a take-home point that you need to bear in mind when you do calculations of the future. And if it comes up in the GPhC exam, you know what to stay alert on, basically. So Timolol, a patient with type 1 diabetes, uses 22 units of Levemir in the morning, 18 units at night. Levemir comes in 3 ml cartridges in 100 units per ml solution. So before we go on, how many units is going to be in one cartridge? Just before we go on. 300 units per cartridge. Perfect. Because some people forget to leave that bit, forget to sort that bit out. The patient has come on holiday and has left his insulin at home and won't be returning for 30 days. provided that the patient, and this is the key bit, does not want to use insulin from more than 1 pen in a day, how many pens need to be supplied to the patient? So what does that mean? That means we can't use pens to the absolute limit, because then you might have to use a bit from 1 pen and then the rest of the dose from the second pen. They do not want to use insulin from more than 1 pen in a day. Cool. So work out how many they use in a day. How many units in a day? 18 in the morning, 22 at night, 40 units overall. There's 300 units per pen. So 300 divided by 40 is 7.5. Each pen lasts 7 days, and 5 pens are needed for 30 days. So everyone got 4, but do people understand why the answer is now 5? I think, how many people did we have saying it was 5? Just trying to look through. Cool. We had 1 person say it was 5. So, you know, at least 1 person got it. But basically, because 1 pen lasts 7.5 days, and they don't want to use more than 1 pen in a day, so they only want to use insulin from 1 pen in 1 day. Does that part make sense? So what are they going to do with a 0.5? Are they going to use it, or are they going to throw it away? They're going to throw it away. So that means 1 pen lasts 7 days. Does everyone follow me till that point? 1 pen lasts 7 days. Everyone following me till that point? Yeah, good. That's enough yeses. So we can't give them 7.3. We can't give them 4.3 pens, whatever 30 divided by 7 is. We can't give 4.3 pens. We can only give total rounded up pens. So to supply them for the whole 30 days, we're going to need to give them the complete 5 pens. Does that make sense? Does that make sense now? Yeah. So that's one thing that I want you to take home from this. Notice that they said the patient does not want to use insulin from more than 1 pen in a day. So that means once they come to the end of day 7, they're not going to take the rest of this with them for day number 8. They're just going to throw it away. If it didn't say that, if it didn't say the patient does not want to use insulin from more than 1 pen in a day, then the answer would have been 4. So Arjun, as you perfectly just asked now, so yeah, we would just do 4. You do you do 30 divided by 7.5 if they didn't say that, and the answer would have been 4. But that's the difference. That's the key difference that we know now, and we will know for the exam. So that's 1 mark that we now will not lose in the exam. Happy days. Right. Going on to the next one. You got 3 minutes. Tell you what, I'm going to do 2.5 minutes. Don't want to have too much kind of like empty space of me not talking during this lecture. But your time starts now. Okie dokie. Cool. What's the answers? Everyone shoot me the answers. Keep them coming. Cool. Cool. Right. So what I'm going to ask is everyone familiar with this equation? Yes or no? Are people familiar with this equation? So what this equation does is where it basically, when you're in the situation where you've got, I wonder if I can annotate. If you've got solution 1 and solution 2, looks like some guy with sunglasses on. How you apply this equation is when you've got solution 1, solution 2, you want to mix it all together and you end up with solution 3, right? And you want to know the concentration of solution 3. We have to know, we basically have to know C1, V1 for solution 1, and we also have to know C2 and V2 for solution number 2. So we need to know all 4 parts. We need to know the concentration, the volume for 1 and 2, and then that's how we can use this equation to give us the concentration and volume of solution 3. Okay, does that make sense to people so far? Like why we use this equation? Yeah, good. So having said that, let's take a look. So the pharmacist has been directed to add 60 mils of distilled water to 20 mils of pure calamine solution. But I just said that we need to know concentrations and volumes for both. Do we know the concentration of distilled water and pure calamine when we're talking about the concentration of calamine? Because that's what we're asking, the overall strength of calamine. Do we know the concentration of calamine in distilled water? Who can put the answer in the chat? It's going to be 0 because you'd hope that distilled water has 0% calamine in it, right? Your typical distilled water. What about pure calamine? What does the word pure mean? What percentage of calamine is in pure calamine? It's 100%. It's pure, like pure gold, 100% gold. The overall solution is then added to 40 mils of 2% weight per volume calamine solution to form a product that can be sold over the counter. What's the overall strength? Round your answer to 1 decimal place. Exactly. 100% no impurities for pure calamine. So what do we do? Well, when we think of it, solution 1 is going to be, oh, I'm going to do it without the annotations actually. But remember how we're adding 2 solutions to get a third one? So we need to do that once and then again. So this is like a double dilution kind of thing. So we're adding 60 mils of distilled water to 20 mils of pure calamine first. So that's 60 times 0, which is just going to be 0, plus 20 times 100, because 100% pure calamine, divided by the volumes, like the 2 volumes. So 60 and 20 added together. So 2000 divided by 80 is 25. Now, we now know what the solution of that product is. We then get that, and then we mix it with 400 mils of 2% calamine solution. So we know that that's going to be 25% weight per volume, because remember, we're ending up with, let me annotate actually. So we did 1 plus 2 equals 80 mils of 25% weight per volume solution. Now we're mixing that with So we've done that part. Great. Now we're doing that with 400 mils of 2%. Yeah, apologies. This should be a 1. My bad. Cool. So someone's saying, where did you get the 25 from? Well, that was as a result of mixing these two together. So that gave us 25% weight per volume, 80 mils of it. And now we're mixing that with 400 mils of 2%. So we are literally doing 25 times 80. So that's this one. Plus 400 times 2. That's that one. Over. So we got 80 mils. And we got 400 mils. When we work that all out, it gives us an answer of 5.83333. And that's 5.8. In 1 decimal place anyway. Does that make sense to people? What part are people confused on? If they want to ask something. Make sense now? So yeah, this is the formula that you must memorize. Why is 2 being put in as a percentage? Because that's what concentrations are measured at. Like the full saying would be 2% weight per volume, right? So only use this equation when we have an unknown concentration. You can only use this equation when you know all 4 of these. And you want to know C3 and V3. So adding these together to get a final kind of product. Are these standards of questions we would expect to see? I mean, like, I wouldn't say that isn't a GPhC style question. No, we wouldn't do that. We wouldn't do that. Because concentration comes as grams per 100 mils. So that's what it technically stands for. Yeah, well, technically this is an equation to find out concentration 3, because to find out V3, it's very easy. All you have to do is add the 2 volumes together. I'd say this is a 7 out of 10 difficulty, personally. But yeah. Suppose there are multiple ways of doing it, but how have you done it? Can you always do it like adding the 20 mils in 80 mils and then 2% in 4? What are you saying? I'm not too sure, but the best way to do these types of questions is honestly using this equation and have it memorized. Cool. On to the next one. Okay. On to the next one. So you've got 2.5 minutes for this one. Your time starts now. Hello, everyone. Right, put in your answers. Let's hear it. All right. How have people got those answers? Have I made a mistake? Well, whenever I see these sorts of answers, I feel like I've made a mistake somewhere in the question. Let's have a quick look. Right. That would be it. Yeah, that's a bit of a fail. But we are going to, let me see if I can quickly change this. So for when people look at it later, dose of 20 milligrams, yeah, per kilograms. So this is what it was meant to say. Right. Good thing people spotted that. So pretend that we didn't make that mistake. And let's go through this now all together. The take-home point that I want to basically tell people, and it would have worked a lot smoother if that was in there, was it's easier to merge things together before moving on to the next sentence. What I mean by that is, so if we read this out, venlafaxine, a patient weighing 77 kilograms, has been prescribed a dose of vancomycin, 20 milligrams, 3 times a day. Cool. How many moving parts, how many parts of the equation are there already before getting onto the next, part? How many? There's 3 parts, right? Before getting onto the next line, we're already looking at 3 parts. So why don't we just narrow that down or make that easier and times it all out before moving on to the next bit? So we've got 77 kilograms, 20 milligrams per kilograms, and we're taking it 3 times a day. So we are literally using 4,620 milligrams for the whole kind of day. Okay. And yeah, it didn't say. So this was a very poorly written question, and I will apologize on that behalf, but hopefully I can still teach you something out of it. So the question should ask how many milliliters of vancomycin solution needs to be prepared to give this daily dose. Let me quickly change that as well, because we will be, this will be okay because a bit of last minute changes doesn't hurt anyone, right? To give this daily dose. Okay, does that make sense now? Hopefully it does. Does that make sense? Happy days, right, sorted. We've worked out that every day the patient takes 4,620 milligrams of vancomycin. Now let's go into the rest of the question. So we've worked that out. The pharmacist needs to make it out of 100 milligrams per 5 ml solution in order to give it as an infusion. How many milliliters of vancomycin solution needs to be prepared to give this dose? Give your answer to the nearest 5 mils. Right. So, because we worked it all out already, all we need to do now is 4,620 milligrams of vancomycin given as 100 milligrams per 5 mils will be 4,680 divided by 100 times by 5 gives us 231 mils, and given to the nearest 5 mils is 230 mils. So the take-home point from this is try and remove as many working parts as possible and then get it into one kind of thing that you then need to move on. Okay, this question was really, really bad. Gee. There we go. This is the worst question I've ever done, and it's a good thing it's in front of like 100 people. Really good. Cool. Yeah, this is the highlight of the session for me today. 3 little mistakes, but no one saw that, right? I guess it was not mentioned. It was per kilograms. Yeah, so it's per kilograms. That's one of the mistakes that was on this question. Hopefully there's not many more mistakes to go, but I promise I did look through it. Maybe this was an old version. We'll see. Cool. Hopefully there's no mistakes on this one. Let's read it out anyway. So I'm going to read it out just because I don't trust myself now, that there were no mistakes. So the pharmacist has been directed to supply 1.6 grams of vancomycin to a patient through an IV pump so that the solution comes out as 50 milligrams per liter. Amiodarone has a displacement value of 200 milligrams per milliliter and must be diluted down with distilled water. What is the total amount of distilled water to reconstitute the entire dose of vancomycin? Give your answer to 1 decimal place. There's no mistakes that I can think of on this one, but you have 2.5 minutes. Your time starts now. Yeah, that is one small mistake then. Oh dear. Sorry, guys. There we go. That was one, wouldn't have changed the question, but there we go. One last question. Put the answer into the chat. Let's quickly have it. What was it? What was the answer? Are these questions meant for first year students? I wouldn't say so, to be honest. So if you're a first year student and you're attempting this, don't feel too bad if you're struggling. It's more so pre-reg level, in my opinion anyway. but every university is different. They can ask you different things, but let's work this one out. So I'm glad that loads of people got this one right, to be honest, because I'd say this one's quite difficult. Pharmacist has been, and yes, this is meant to say, yeah. So we're going to quickly go into that as well, Georgia. Why some people, including, oh, going to make 2 little changes. So that should have been 24.0. And then this one should have said amiodarone as well. I need to look at the questions on 2 separate days rather than, that's just a note to myself. Right. Supply 1.6 grams of vancomycin to a patient through an IV pump so that the solution comes out as 50 milligrams per mils. This should say vancomycin. This is really annoying me. It has a displacement value of 200 milligrams per mils and must be diluted down with distilled water. So what can we do? What can we do like so far? We don't really have much that we can work with now, but what we basically need to do, and it doesn't hurt to draw things out, just draw it out. So we can work out the final solution. We can work out how much overall solution needs to be given. If we're given 1.6 grams, or in other words, 1600 milligrams as 50 milligrams per milliliters, we are going to have a total solution of 32 mils, right? Then what can we do? So we need to work out the displacement value of vancomycin, and only then can we work out how much distilled water is needed. So some of it's going to be distilled water. And the rest is going to be vancomycin. Cool. But how we want to know this? How do we do that? We have to work this out first, and we can do that. So, this vancomycin has a displacement value of 200 milligrams per mil. So that means 200 milligrams literally equals 1 mil. So what will 1,600 milligrams equal? It will equal 8 mils. So from there, it's a bit easier to work out the distilled water. All we have to do is 32 minus 8 equals 24 mils. And yeah, it's said to 1 decimal place, so it should have been 24.0. Does that make sense? So I would say that's kind of like 8 out of 10 difficulty. But once you know what to do, it's quite easy. And again, drawing things out really, really helps. So my take-home point from this question was draw things out, because it really, really does help. Right. Before, well, ideally they wouldn't. If it did literally ask for 1 decimal place, you would add the 0.0, yeah. If it says give it to 1 decimal place, do we actually have to write 24.0 on the exam? If you didn't, it would be marked wrong. Yeah, so if it literally says to 1 decimal place, make sure you give it to 1 decimal place. Cool. Any questions before we go through some really good tips? Some really, really, really good tips, apparently. Claimed by myself. Everyone ready to go? Oh, you've got 1 question. Feel free. What's the question? About a previous question? Let's quickly tackle that at the end then, just so we can keep anything going. Are we able to use the BNF and GPhC exam? No. That one I can quickly answer. So, for opioid conversions, you'd probably be given a little snippet, and it's called a resource question. But let's go through some tips. So, calculation tips. read the last line of the question first. Why do I suggest that? So, for example, this one, for example, this one, if we read the last line of the question first, how many milliliters of vancomycin solution needs to be prepared to give this daily dose? Give your answer to the nearest 5 mils. So we know what the context of the whole question is, right? We know what the context of the question is, and what you should be doing every time you read the last line is highlight 2 things. Highlight the units, so the milliliters, and highlight any rounding. Those 2 things you should always highlight. Okay, cool. It lets you work out what the whole question is asking, and then you also can highlight the 2 most important parts. That if you've got the question right and you've done all the tricky part, don't lose mark on the easiest parts, which is the units and the rounding. Reduce the moving parts as you go along. So remember what we spoke about, the 80 kilogram patient taking 20 milligrams per kilogram. Just turn that into a patient dose 16,000 before you move on to the next part. That's my best suggestion, because it makes things a lot less complicated as you read it again. Don't be afraid to start drawing. A picture really does help with the question, especially dilution questions. So always, if you need, make a drawing. Doesn't need to be anything extravagant, but yeah, you should. For the GPhC exam sitters, especially, do time practice in exam conditions. Calculations is, I'd say, tricky in 2 parts, because people don't really like calculations. That's the first. And the second reason is you have to do 40 questions in 120 minutes. So the only way you're going to pick up the speed and the accuracy is by doing time practice in exam conditions. So that's a must. If you haven't done that before the exam, you're going to not find the exam go as smoothly as you'd hope. That's a must. Clinical tips. Again, read the last line carefully. Look out for negatives. So the difference being, which of the following options is a side effect? Which of the following options is not a side effect? So we might see a question saying, it might be talking about, I don't know, methotrexate. And as one of the options, you'll quickly see it says something about like pulmonary toxicity. And you'll quickly think in your head, oh yeah, I know that's a side effect, I'm going to tick that. And you haven't read the other 4. And the question's asked, what is not the side effect? And you've just lost yourself a mark, basically. So don't do that. Highlight any negatives and be sure to look out for those. If you don't get it, move on to the next one. Flag it, come back to it later when you have more time, when you've already smashed out 90 questions and the remaining 30 you're finding a little bit more difficult, and you've got loads and loads of time to work it out properly, and you don't have the stress that, oh, this is only question 4 of 120 and I don't get it. If you don't get it, and you can you normally can tell when you're going to find a question difficult within like the first 15 seconds of reading it. Just flag it and come back to it later when you've got more time, because you don't want to risk losing easy marks later on, questions that you knew exactly, because you spent 10 minutes trying to work out 1 mark, basically. That's a bad way to waste some time. Understand that they are asking for the most correct answer in the GPhC exam. So, for example, bisoprolol, which of the following options is a side effect or most common side effect of bisoprolol? Now, in the SPCs, it says both dizziness and hypersensitivity are a side effect of bisoprolol. but which one is more correct? So it's got that option as well. It's got the GPhC exam. There may be certain questions where there may be more than one correct answer, but you're looking to select the one which is more correct. So out of dizziness and hypersensitivity, dizziness wins, because that's very common, where hypersensitivity is rare, for example. So that's another thing that you need to quickly distinguish. So those were the tips for calcs and clinical. Just going to whiz through some general tips between now and the exam, what you should be doing. And yeah, we'll move on to a Q&A at the end. For anyone who's yet to sit the exam, sorry, not yet to sit the exam, yet to start the training year, this will still be really good information so you know what you're expected to learn for the GPhC exam. Make sure you're learning the right things. How do we do that? We literally go to the GPhC website, we type in GPhC framework, and it will tell you exactly what it is that you need to learn. So you've got your clinical exam, your part 2, which is considered. For calculations, that's part 1. These are the topics you need to learn. For part 2, we've got these, MEP and OTC. So therapeutic areas being cardiovascular, nervous system, endocrine, and infections, they are high weighted. That means more questions will be asked on these 4 topics than any other topic. Okay. Then medium is genitourinary, gastrointestinal, respiratory, immune system, and malignant disease, blood and nutrition. Those are medium weighted. So that means a normal amount of questions will be asked on these topics. And then low weighted topics are musculoskeletal, eyes, ears, nose, oropharynx, skin, vaccines, and anesthesia. There will be less questions asked on this. The one thing that I would pay attention to is musculoskeletal system, because that includes stuff like NSAIDs and methotrexate. So that is a must that you need to go over from MSK. And then at least one question will come up from these. Then you've got MEP and OTC. If anyone hasn't done so already, download the app. I've put it in the chat. OTC Consult. It's free. It's really good. So give that a download. That's a really good resource to use for free OTC help. Then you've got calculations, as I kind of went over. That's what you need to learn. So that's the weighting. And these are all the topics. It's from the GPhC website. Don't trust anywhere else. These are the topics. Things to consider when basically looking where to learn stuff, by the way. Always try to learn things from kind of the most kind of reputable places. So if you do look for external help, just consider what's included. Is the tutor credible? What are they promising? Is it a worthwhile investment? Check the reviews. Things to avoid: question banks with no unexplained answers, and content where you can't reach out to the author. Because I've seen this so many times where people will come to me and be like, I've spent about 30 minutes where I've kind of tried to work out the answer for this question and why this is correct. And I've been like, well, first of all, you should reach out to the author of the content. And if you can't, then don't do those questions. And second of all, if it doesn't have worked answers, just don't risk wasting time on those types of questions. You don't want to be taught from something wrong or out of date. So these, what you should learn from, for the person who asked about what's the name of the app. And yeah, it is an animated picture. It's like a bluey animated picture with, I think it's like a female pharmacist, kind of, that's the image. It's OTC Consult. But where you should be learning from is NICE, CKS, NHS website, government websites. So for example, stuff like MHRA recalls, that's normally from the government website. SPCs, when you're looking at side effects and monitoring parameters, that's where you get it from, SPC, BNF, MEP, OTC consult. And this is a little kind of, okay, people don't really appreciate this one as much, but this is something that I used and I think it's helpful. The Boots website, when you go and you pretend to basically be a customer on the Boots website and you select sumatriptan, it will tell you everything. It will say, this can't be used between age this and that. You can't use it if you've got this, this and that, this and that. You can't do that. So the Boots website is also pretty good way of learning things. What you don't want to learn from, old Dropboxes and drives. The GPhC exam is a pass-fail exam. You can fail by 1 mark, and things change in pharmacy. And I don't know how to express this enough. Do not learn from old notes. Make sure you also check the latest guidance. The biggest no-no is just learning from old notes, because you'll shoot yourself in the foot, basically. For example, if people can tell me, what is the first line treatment for focal seizures? What's the first line treatment for focal seizures? If people can tell me. Oh, it's been disabled. Levetiracetam, yeah, the 2 L's. So it's clearly someone that's been on my course. Levetiracetam and lamotrigine. If you went onto a Dropbox from preparations for exams for even 2021, it will say carbamazepine and lamotrigine. But that is now wrong. So ensure you are learning from up-to-date resources. BNF Online is constantly, well, it's up there as being very up-to-date. The NICE website is probably the most up-to-date thing out there. But yeah. Get to know the exam. So, does anyone know, like, what exams are going to be asking you? Is everyone aware of like what the structure of the exam is? If not, we're quickly going to go through it. Hopefully everyone knows now that you've done like 1 or 2 mocks by now, so you should know. But basically, there's going to be 2 exams on the same day. You've got part 1, which is calculations, as I previously mentioned, 40 questions in 2 hours. Part 2 is clinical, 120 questions, 2.5 hours. The first 90 are going to be choosing the best answer out of 5 options. The last 30 are going to be extended matching questions, choosing an option once, more than once, or not at all. And the questions are based on the GPhC framework. Cool. An example of a part 1 question is calculations. Patient has come into the pharmacy with a prescription for 500 milligrams of amoxicillin 3 times a day for 5 days. You only have 250 milligrams per 5 ml stock solution. How many mils of amoxicillin solution will be needed to supply the whole course? This is like a easy style of question, but this is basically the format that the calculation questions look like, and more information can be found out about those on the GPhC website as well when you look at practice questions. But yeah, anyway, that one, the answer was 150 mils, 500 milligrams as 250 milligrams per 5 mil is 10 mils, times by 3, times by 5, easy peasy. Multiple choice questions. Let's see if people can get this right. So feel free to use the chat function. What is the therapeutic range for carbamazepine? So we've got loads of people going for D. Any other thoughts? Perfect, D. Now let's do a little bit more extra learning because I feel like we can. What is 10 to 20 milligrams per liter? What's that the therapeutic range for? Phenytoin and theophylline. Perfect. 0.8 to 1.0. Is it lithium all the time? All the time for lithium? Even when there are maintenance at home? You sure? Just acute. Perfect. Awesome. Under 5 milligrams per liter. Let's say people can get this one. Gentamicin, what is that? Peak or a trough? Peak and endocarditis. Cool. Think so. And then what about, so we know this is for carbamazepine, and then 10 to 15 micrograms per minute. I think I just made that last one up, but there we go. We know that there's one correct answer. This is what 90 of the questions will be like. The first 90 of the questions will be like this. Then we've got extended matching questions, and we've got 30 questions like this. I don't mean 30 times 3, but as in like there'll be 30 questions overall. So let's hear the answer. Which electrolyte imbalance would happen when given theophylline and furosemide? So people are going for D, are they? Hypokalemia, perfect. Which electrolyte imbalance would happen when given carbamazepine and citalopram? Loads of B's. And last one, which electrolyte imbalance would happen when given ramipril and ibuprofen? C. Cool. So we know what the exam's like now. Hopefully most of you already knew, but for those who are still in university, this is some new insight, I'm sure. That's what the exam is like. This is what you need to prepare for. And preparation is key. How do I prepare? I do not go. I'm going to do the whole of CNS next week. That's just not a good way to do things. The best way to do things is set yourself mini goals and tackle them one by one. And you can do this by, for example, using, this is a completely free resource, by the way. If you do need it, feel free to reach out. Use the RevisePharma clinical checklist. And you can literally say, okay, on Monday, epilepsy, on Tuesday, bipolar disorder and dementia. Wednesday, I'm going to have a break. Thursday, Parkinson's disease and psychosis and schizophrenia. Friday, anxiety and depression. And then over the weekend, Saturday, Sunday, I'm going to go hard on like Sunday, and I'm going to do sleep disorders, attention deficit disorder, substance and migraines. And then on the following, like Monday, I'll do nausea, vomiting, pain management on Tuesday. You've done the whole of central nervous system in 10 days. But that is a lot more morale boosting, as it were, than to just go, I'm going to do the whole of CNS in 10 days, because you really don't know where to start when you say phrases like that. So yeah, small goals, loads of mini goals. And what could your routine basically look like? This is based on a 10-hour week. This is great. This is kind of cut through the 10 hours. But does 10 hours seem manageable per week of revision? How does 10 hours a week sound for people? Does it sound too much or too little? Or something that people can't really seem to do whilst working at the same time? Manageable. I mean, at this stage, you should probably be doing more, but if you're starting right at the start of training year, 10 hours a week sounds a bit daunting, but promise it's not that bad, and you don't have to like change your life too much. All you need to do is fit in 1.5 hours, like 3 times during the 5 working day week, and then do like 5.5 hours over the weekend. So my timetable, what it looks like, was woke up at 8 a.m., to go to work, started work at 9, finished at 6. Got home at 6:30, unwinded and had dinner till about 8. So, 8 p.m. starting revision for 1.5 hours. And between 9:30 and 12, literally go watch Netflix, go to the gym, do whatever. And then wake up the next day at 8 a.m. And that's still like 8 hours sleep, right? You're not depriving yourself of sleep. You're not forcing yourself too much. But you still manage to fit in 4.5 hours during the week. And then weekends, I did like 6 hours over the 2 days. You can either do 9 to 12 both days, like just do 3 hours per day. And then you still have the rest of the weekend to enjoy. Or you can not do anything on one day and then do the 6 hours on one of the days of the weekend. So that's how you should probably try and look at it. Don't say, oh, I need to do like so much revision this week. Put yourself like hours, how much you need to do, how much you can do per day. But again, towards this point, someone's even asked, how much should you be doing now, roughly, do you think? I'd say at least sacrifice a good 15 hours. So where you only do 6 hours over the 2 days weekends, you could fit in 10 hours. I mean, that's not unreasonable, especially for the next kind of 2.5 months. You can kind of sacrifice kind of going out on weekends and stuff like that for the next 2.5 months. But do not overwork, enjoy your life. But yeah. Make your own notes on paper. This is actually an example of my notes from when I was a trainee, and they don't look amazing. They don't look really sparkly or highlighted or whatever, but they were handwritten. And when you handwrite notes, it stays in your brain more. Most people touch type when they're typing notes. They're not even looking at what they're typing. They're just typing something that they've seen somewhere. People even copy and paste from like the online BNF. They don't really actually know what's in their notes. So I would always suggest handwriting your notes. Some of us are iPad baddies. Is that still okay in your opinion? I would honestly just write it on paper. There's another reason. You know where everything is on these pieces of paper. You know where your notes, you know where everything is in your notes, and you know where to refer to quickly if you need to find out a bit of information. And when it comes to exam season, you can put your laptop, you can put your phone or iPad, like put it under your pillow or somewhere, and it won't distract you. You're just learning from paper, and it's a lot easier on the eyes. Less strain on your eyes. Use blue ink as well, because that helps you retain things. That's a little life hack. And as I said, the final bit of like preparation is get used to working under time conditions. If you don't do that, you're going to probably struggle a bit more in the exam than you'd hope. I have loads of people messaging me every year saying they passed, and I have a select few messaging me saying that they failed. And I ask people, what steps did you take to prepare this time around? And one of the things that most of them don't mention is timed practice. So there, in my opinion, there is a correlation between those who don't do time practice and those who fail. Make sure you fit in some time for that, basically, not to scare anyone. We've still got 2.5 months left. Even if you do time practice a month before the exam, at least you're doing time practice. Get yourself one of these. I'm not a promoter for kitchen stop clocks, I promise, but get yourself one of these. Best £7 I spent, honestly. It reduces procrastination, because once you've got a timer going up, if anyone's competitive, like they try to not waste time. It increases productivity, and it helps setting time aside. And it will help you, obviously, when you're doing time practice papers. Calculations, 3 minutes per question. Clinical, 1.25 minutes per question. calculations, though I say 3 minutes per question, that's not a strict rule. Some questions can literally take you 20 seconds. Some questions will take you about 5 minutes. Perfectly normal. Cool. Going on to the Q&A session. And I think for this part, I think I promised I'd turn back my camera. Cool. So I am gonna, well, should I stop sharing or? There we go. Cool. So how should we do this, Tanya? What, how should we do this? So should I just pick any random questions?
Yeah, I think the best thing actually might be the Q&A function, just because a lot of the questions that have been put in the chat, they might have been lost now. So guys, if you have any questions, please do put them in the Q&A function bit. Also, you can speak as well. I can allow you to talk if you want to raise your hand and speak.
Cool, that's perfect. So anonymous attendee, Tanya, I don't know what the rules are. Are we allowed to talk about other external resources or beneficial resources? Because someone's asked about, I need a resource that teaches maths topics by topic.
Yeah, if from your own personal opinion, if you have one, then that's fine. But just as a BPSA disclaimer type thing, that we don't endorse these resources.
Okay,
yeah.
So BPSA doesn't endorse it, but RevisePharma does have clinical and calcs help, but try not to talk too much about that. And if you did want more information, just reach out to me on Instagram for resources. I think that's where we'll leave it for the resource type questions. Do these topics change year after year? So I'm assuming you asked that when we were looking at this, right? Not really. I mean, rarely. The weighting might change. So I do remember when I sat the exam, musculoskeletal was medium weighted, but other than that, it doesn't really change, no. Again, always get this information from the GPhC website, because between the time that I copied and pasted it from here, I could have got it wrong. But I have checked quite recently as well. Right. Would there be any questions based on MHRA warnings? Yeah, you should definitely definitely pay attention to the MHRA warnings. Those are like quite big, especially the new ones. Obviously, I don't know what the GPhC asked as well. I can't make any sort of claims, but I mean, that's a kind of easy question to ask people about new MHRA warnings for sure. What score do we need to achieve to pass? So there's no set score, but normally it's around 70% in both clinical and calcs. There's no amalgamation, so you need to pass both, but it's normally around 70%. Can be higher, can be lower, depending on how the exam goes. How do you approach learning BNF monographs for each drug? I mean, I literally look at the main common side effects, and when it comes to side effects, I probably wouldn't even look at the BNF. I'd go to the SPC, and there's a section that says special instructions for use or something, and that kind of tells you the main kind of topics, main points you need to keep in mind for drugs. When did I start studying for the exam? So I always have the opinion to get the clinical done really early. Get the clinical done really early, within the first 4 months of your training year, and that just changes your whole GPhC training year experience. Because I always thought If I don't know anything clinical and I'm getting prescriptions coming in, so for example, if a prescription came to me and I knew nothing clinical, prescription said clopidogrel and omeprazole, I'll go, cool, all right, dispense clopidogrel and omeprazole. I wouldn't know that there was an interaction between those two, and I'd give it to the pharmacist to be checked. If I knew my clinical, I would have said, no, this is a red flag, change the omeprazole to lansoprazole. So for those who haven't started their training year yet, strongly suggest when you do come to training year, start tackling the clinical within the first 3 to 4 months of your training year. It just changes, not even talking about the exam, it just changes your training year experience. So regarding whether the GPhC exam focuses more on drugs or diagnosis and signs and symptoms, there's no way we can kind of guess that. The GPhC doesn't accredit anyone, so there's anything that's said about how the GPhC will act will just be speculation. There's nothing there. Really struggle to retain information. Are there techniques that you use to retain information in a short period of time? What I used to do was I'd get a piece of paper, and let's say I'm trying to memorize Alzheimer's disease. I would get a piece of paper, write everything that I knew about Alzheimer's disease, and then compare it to my notes and highlight the things that I forgot to kind of write down, and then pay attention to those as well. And then do it again and again and again till you can literally memorize everything from that topic, and then also condense the notes. So condense it into trigger words. So you might say Alzheimer's disease, donepezil, galantamine, and rivastigmine. You should then be able to just go Alzheimer's disease, acetylcholinesterase inhibitors, and that should trigger you to go, okay, but the acetylcholinesterase inhibitors are donepezil, galantamine, and rivastigmine. So yeah, just I'm quite old-fashioned in the way that I think just writing things down will help you memorize things. It works for me anyway. That's how I kind of thought about it. Their bigger cohort this year, do you think the exam will be harder to pass? Again, no way to know that. Honestly, it looks a bit long to go through all these topics. Do you advise we do related topics while studying cardiovascular, renal? I mean, renal's not a topic, but whatever makes it easier for you, then sure. How hard are the calculations questions? I'd say most of them are a good 6 out of 10. I'd say from my experience, can be completely different. It is completely different every single time around. But from my experience, it was, I'd say maybe there was 5 or 6 10-second like no-brainers in my exam, and to me anyway. There was about 30 that were mediocre difficulty, and there was like 4 or 5 where I was like, well, I need to come back to this later, and really spend some time on it. So it's a good mix. Do you have any resources you recommend that may or may not be endorsed by the BPSA for core drugs? Again, the RevisePharma notes goes through all the clinical topics and the drugs, but not endorsed by the BPSA. To the nearest 5 mils, that was just an error, because it should have been 230. But yeah, where was it? This one, wasn't it? Yeah, because the answer was 230 to the nearest 5 mils. So it can be 230, 235, because 231's in the middle of those, and it's closer to 230. Is it too late to properly start studying now? Depends on a load of things, to be honest. Depends on how much holiday you have to take, because you can really gain some time, save yourself there by taking days off. But I wouldn't say it's the end of the world if you're starting now, for sure. I know people who have started now and still passed, but I wouldn't recommend it. I would have liked to have thought that people would have started at least a month or two ago. But it can be done. It may be the matter that you may rely more on resources if you're starting now, rather than just going through the BNF yourself. But it's never too late. That's my opinion. It's never too late, unless it's the day before the exam and you haven't started, then just, yeah, that's too late. Are you also on Twitter, as I don't have Instagram? I'm not on Twitter. I am on Instagram. A lot of people, and this is just what I've seen because I have loads of weird kind of like ghost accounts following my page, but it tends to be people that just make an Instagram ghost account for all the revision pages, and that's what they do. They make themselves like normally an Instagram page called Pharmacy Revision, and they follow all the big pages on Instagram. So do contemplate it, because it is a good resource and it's free. And I'm not just talking about my page, there's many other pages. Flashcard Pharmacist, he's a good one. It's probably who inspired me. Although I've been revising throughout the year, still feel overwhelmed. Did you experience this? Yeah, I mean, yeah, that's completely normal. I felt overwhelmed even going into the exam. I think if you're trying to kind of look for kind of how to not feel kind of at least a little bit feeling overwhelmed about this exam. I don't know if I worded that correctly. I think it's just basically unrealistic to not feel a tiny bit overwhelmed for the exam. If you're feeling super overwhelmed and it's getting in the way of your revision, that's a completely different thing. And maybe just reach out to pharmacist support about that sort of stuff. I don't know, does the BPSA help? Any other resources about feeling overwhelmed for exams? You guys could probably
yeah, we made a post actually on signposting to mental health resources, and also we work with pharmacist support in doing that as well.
Good. Yeah. So from my personal experience, I was very not panicking, almost panicky leading up to the exam. So don't worry if you feel like that as well. It's quite normal, but obviously if that's getting in the way of your revision, then feel free to reach out to like pharmacist support at the likes and BPSA and even PDA. They're good. Did you have time to go through all your questions after answering them? Yes, I did. For some reason, adrenaline just carried me through the exam and I managed to do things really, really quickly. Hopefully that happens to you as well. Did you have suppository questions? From what I can remember, we didn't have suppository questions in my exam. Is there a break between calculations and clinical part of the exam? Yeah, there's a 1 hour break. Did I include that? I didn't include that. But yeah, there is a 1 hour break between these two. And for me personally, it was just doing a little bit of last minute revision. Where should you be in terms of revision at this point? i.e. chapters or starting past papers? Ideally, you would have got at least the high weighted topics out of the way by now. If you are still making notes, that's perfectly fine. Just keep on going. How do you score 100% in calcs? I don't even know, to be honest. That's the honest truth. I walked out thinking that I did better in clinical, but obviously I didn't. But I will say, honestly, though, I knew I had done well. Honestly, thinking about it, I knew I had done well, and that's because of the amount of practice I did, and because of, I like to think this technique helped a lot. Reading the last line of the question first, it just gives you insight of what the question will be asking you, and it gives you the opportunity to highlight these two important bits to make sure you don't miss out marks over there. Because most people that get like 38, 37 out of 40, they probably should have also got 40 out of 40, but they probably just lost a few marks here. So those two points is kind of like major to bear in mind. If you plan revision well, do you think it's a better idea to do high weighted last or closer to the exam? The first topics you should cover is the high weighted topics. What other level of difficulty calcs is likely to come up? Honestly, it would all be speculation if I were to tell you the level of difficulty of the exam. But from my personal experience, it was mostly mediocre exams, a few easy ones, a few trickier ones. That's all I can remember from my exam, and it changes every single exam. But again, I've only sat it once. I'm going off people's experiences on how they found those exams. Any other questions? Are the SPC questions really wordy? I'd say they're quite clear on what they want you to find out, to be honest. Again, I don't know if they tend to repeat questions. I've literally sat it once, thankfully. That's the one downside. I can't really tell you if they repeat questions because, well, and hopefully you'll never find out if they repeat questions because you'll only need to sit it once. Any other questions? I'm going to leave it last on this slide. Follow RevisePharma. Be drawn into the social media trend. Is there pharmacy law questions? Do they cover this in the exam? Yeah, that's part of it. So MEP and OTC, as well as those big clinical topics. Definitely in there. Will RevisePharma be doing more free sessions? Of course. Of course we do free sessions. Not through the BPSA, but I love doing free sessions. Although technically they're not free anymore. I've started charging £1 for the sessions just because I used to sell out 100 free sessions, 20 people would show up, and that would kind of like annoy me. So it's £1 for the sessions. You get more value than £1 out of it. It's more so to kind of ensure that people come, because we get loads of people saying they'll come and don't show up. How would you memorize or differentiate between side effects of drugs? Acronyms and flashcards. Have flashcards for each drug and make an acronym. Lovely way to do it. No worries, Exonia. Don't know if I pronounced your name right, but I'm glad you enjoyed. We'll keep it as £1 for that who asked to go back to free, because it's really helped people. Just those who wanted to come along managed to get tickets now. Cool.
That's great. Well, I think we'll end it at that. Thank you so much, Shaya, for coming in and sharing your wisdom on pharmacy calculations and your exam tips as well. I sat my GPhC exam last year actually, so something like this would have been really beneficial. And I actually remember watching your live videos as well, which was really helpful. So thank you so much, and I'm sure I'm speaking on behalf of everyone. Found it really helpful as well.
Thank you for having me. Thank you for having me. It was a great pleasure. I do tend to notice that I can ramble on and on and on and go on a tangent, but hopefully everyone kind of got a bit of useful information out of it. And if you do want to get in contact, again, just follow RevisePharma and you can message me there. I do respond. I do respond to people.
Thank you so much. And if people could fill out the feedback form as well, just so that we know how to provide more webinars that you guys would find useful and how we can do better, and also what you found useful and beneficial, so that we can keep on providing those kind of webinars for you. I'll put a link to our socials as well, and we'll make sure to upload that onto our YouTube page so that for the upcoming GPhC exam, you can refer back to it and do the calculations. Gosh, talking about it is making me my heart beat again, because I remember it this time.
Oh yeah. Well, at least you got to stop revising for the exam once you sat it. I literally have to keep on learning this material. Every single day, I still go through the BNF and learn it just so I can teach it again.
You must know it like the back of your hand now.
Little bit.
Yeah.
But there we go. Awesome.
That's great.
All right.
Thank you so much.
No worries. All the best to everyone wherever you are during your pharmacy career. And thank you again to the BPSA for having me on.